Let me explain it. For me, one of the practices that I've seen in private sectors that I'm not seeing in the public sector is that we have a very nice regulatory framework, right? Thank you to the government, they've done that for us. And then there's a restructuring issues. Majority of the ministries, are not restructured. Now, procurement is relatively new, but I'm also thinking that it's getting old because it was introduced 2015, implemented 2017. Fast forward, we are in 2025. So new is now also relatively very old, right? So you have people carrying out procurement function that don't even understand procurement itself. So if we want to change the system, we've got to put the right people in the position. People that understand that procurement doesn't start with a requisition. It doesn't start when a user department comes to you and say, hi, I need medicine. It doesn't start there. It starts with you understanding your market. We call it market research in supply chain practices. And when you understand market, you will want to understand what do we have as a country, what caliber of suppliers do we have as a country, right? And if we understand what caliber of suppliers we have, you'll be able to understand what are the gaps. What can our suppliers do? What can our suppliers not do? Now, I'm not saying that from a supply chain perspective to just say, okay, then give the job away to foreigners. That's not what I'm saying. I'm saying then you now are coming back with a supply chain practice to say, if you are unable to do A and B and C, how do I capacitate you to be able to do it? Can I capacitate you? Can I not capacitate you? And where I know I cannot capacitate you, we are part of a global market. We're not an island. And so to answer your question, you want to segment your procurement. You cannot have a one approach fits all. You want to see what works for which segment, which doesn't work for another segment, and then your strategy will be driven by the insight that you're getting from the market. And that will also determine the procurement method. You don't start with the procurement method. What does the market say? And that derives any other strategies that you're going to come up with. And as soon as we can start doing that and holding people accountable, as rightfully said, because that's another problem in public procurement. People can make mistakes, money can be lost, and it's okay. It's another day. We move on. Yeah.
Thank you, Doctor. Mr. Mwala, if you can just help us build onto what Dr. Amelia just spoke on, but with regards to what specific reforms or strategic steps can be implemented to streamlining Namibia's medicine procurement processes, ensuring the timely and consistent availability of essential medicines without the involvement of capitalist middlemen. Mr. Mwala.
Okay, thank you for the question. Good evening to you all. Are you there? Okay, thank you for the question. The current supply chain management is not weak. However, we need to revise or to strategize the current or established processes or the laws so that we can make sure that we have available medicine in our public health facilities. As it was mentioned, that one of the cause of to have shortage of medicine in the public health sectors is one fact is that the system. The world is growing fast. We need to have a proper system that talks to our needs. A system that is tailored into Namibia's context. There are a lot of systems in the world that health sectors are using, and we cannot just import or get that system and start using. We need to do a proper research that talks to our needs. And that means we need to develop effective model or inventory management system that will now replace also or minimize the human element in the process. The other thing that we should also know is that the shortage of medicine is a worldwide crisis. It's not only experienced in Namibia. A report that was conducted by WHO in 2020, it says approximately 30% of the developing countries experience the challenges of the we develop a model system that is in our context, we might solve this problem that we are facing today. The other thing that's also affecting the costing of the shortage of medicine in the public health sector is the inefficiency. As it was mentioned by the Honorable Minister, it was saying people are not taking responsible. So there should be accountability. All the officials involved in the process should be answerable to their action, to their act. And the accountability should have a consequences. Accountability without the consequences is meaningless. So there should be a consequences of officials that are not doing their work. Inefficiency also comes with performance management. Clear performance management indicators should be set, and the officials that are working or involved in the process, they should well understood their role. We should allocate or assign the roles and the responsibility to the officials. The officials should know who should be responsible for placing in order, who should be responsible for inventory control, who should be responsible for emergency procurement. Those objective or roles should be clearly set so that it cannot cause the confusion. If everybody is accountable, it means there will be no accountability. That's why it's very important that everybody knows their roles and their responsibility so that they should be answerable to their actions. The other thing that I also want to share with the audience is that procuring of the medicine is not an easy task. It needs involvement from different corners. And blaming each other is not a solution. The government have established clearly a platform to raise your concern, to give your suggestion, to raise your problem. And we must use this platform so that we can improve our system. If we are just blaming the official in the health sector, they cannot alone, they cannot bring changes alone. That's why we need to work together. We need to help each other where those officials in health stuck, and we should come up with innovative ideas so that it can be used. That way we can solve the shortage of medicine. But the officials, that's why innovative need to come in. So if you are working together, maybe you are exposed to a certain area, you need to come up with those ideas and let be implemented.
Thank you, Mr.
Together we can
Mwala.
make it.
Thank you so much for that. So I'm handing this over to Dr. Wamburu and also just contribution from Dr. Stanley. In short, what measures then do you think can be put in place to promote transparency and accountability in procurement decisions within the Namibian healthcare system? Just in short, and then maybe we can also just have 1 or 2 points from our procurement experts. Let's just try to make this one as brief as possible.
Good evening, everybody, and thank you, Miriam, for the question. I'm not a procurement specialist, but I would like to say that I read something very interesting that said, procurement is where money, medicine, and trust meets, which means transparency is not a luxury, it's a necessity within procurement. I do know that Namibia has a solid legal framework for procurement. We've got the Procurement Act, and they publish regularly the awards that are, given, the tender awards and so forth. So if you were to ask me, are we transparent? I would say partially, because the rules are there. But I think the information is not sufficient. And also, I'm not sure whether the public knows that they can go on a website and see, okay, which tender has been awarded, the tender awards and so forth. Helps the public as a, also end users, the clinicians, we also are responsible.
Dr. Stanley.
And I actually agree with.
Dr. Stanley.
And I actually agree with because digital transformation. I think that's the way to go. Especially if you look at our wide open spaces and how big our country is. My personal experience is I would treat somebody and then I would send that person back to Kitmans. A person would come back after 6 months and say, but doctor, the tablets you wrote, we don't get them in Kitmans. Now with digital transformation, maybe the caveat is whether those things are available to the general public to see if whatever medication that I write as a doctor, my patient, because one of the challenges with healthcare, healthcare works on a referral basis, yeah? So you have primary, secondary, tertiary, quaternary healthcare, right? Whether you like it or not, you will find some patients that are sent to Windhoek, yeah? Ideally, as our country develops and we help it develop, we will have referral centers, probably for each region. And one hears our leaders speak about Otjiwarongo, Rundu, Katima, Kitmans, right? However, initially when you are seen by a general doctor, right? I'm still a proponent of general doctors because I feel that's the basis that you build your healthcare system on, right? Your general doctor must be able to communicate with whatever specialist. Your general doctor specialist is in Windhoek in terms of what I wrote for him, right? Now, digital transformation will allow all of us to share what is available within the state, yeah? So it is something that can be used by all the role players within the system, right? Because a lot of what we do is not just for one person. It has multiple users. How will we expose these multiple users to everyone? It's through digital transformation. So I feel that's something we should embrace, especially because of our wide open spaces and our large referral networks.
Okay.
Yeah.
Thank you, Doctor. Just 1 point from Dr. Amelia and 1 point from Mr. Mwala.
Yes, I'm just going to build on what my colleagues have said. And for non-procurement people, you're spot on. And it's really just to say that you need to have an integrated system. Okay. And with that integrated system, and it's not just about having a system, it's about sharing data in a comprehensive manner at every point in that supply chain. So the doctor should be able to see and comprehend what that information is telling him, right? But while me at the other end, maybe I'm a procurement person, that information should come to me and say, oh, wait a minute, this reagent is gonna go up because this kind of testing is kind of increasing. So everybody in the system gets that information. So data insight, yes. Forecasting, very important, very lacking in public procurement, unfortunately. And supplier relationship management, whether you like it or not, the suppliers will influence your system. There are external factors that are absolutely beyond your control. There's nothing much you can do about it. What you can do is have a relationship with your suppliers, manage your market, so that you know you have data at the right time, so you are not reactive, but rather more proactive.
Thank you, Doctor. Mr. Mwala, just one point, then so we can move on to our next concept.
Okay, the system again. I'm coming back to the system again because the system allows us to monitor what is happening. It is integrating our activities. So this will now enable all the officials involved in the process to monitor, to know what is available, what is about to get out. So we need a proper system that is tailored to in our context.
Okay, thank you, Mr. Mwala. This one is to an honorable minister. There has been an occurrence over the procurement of unregistered or substandard medication. What corrective measures have since been put in place to prevent a recurrence?
Okay, good. So, firstly, let me start by saying that it's a good question because there's a lack of information that exists when it comes to the registration of medication and the process. It's actually something that I was speaking to the team about. It would be good for us to do some sort of an information session where we get some specialists on board and we just educate the public on this registration process. So let me start by saying that, and this is important for us to understand. So just because a medication is unregistered doesn't mean it will kill you. So unregistered medication is not a bad thing on its own. And that's important because I think it's been positioned in the headlines to make it seem like it's unregistered, it was made in a dungeon somewhere. That's not true. So unregistered simply means that it has not been registered by our regulatory authority.